I'm Andy Hoskins, I'm editor of BTN Europe, part of the BTN group which organises this show. Was I on mute? I moderated a session on the pre-show bioconference, which was in person, but it's still a novelty to be amongst real human beings. So yes, we are here to talk about vaccines, testing, quarantine and health passes. Before we meet our panel, some are here and we have Simon in Spain, I think. Simon, can you give us a thumbs up if you can hear us all right? There we go, excellent. There is going to be some polling, so you need to either be on Swapcard or on the app, add the session, you're probably all old hands at it now, and be ready to click, because I think you get about 60 seconds when we get to that point. You're also welcome to submit questions via the app. I'll try and keep an eye on that, but as we're all here in person, you can put your hand up as well if you wish to. Okay, and then lastly, if you feel like rating the session upon its conclusion, that would be great as well. Thank you. So I am joined by 4 brilliant panelists, 3 in person and 1 virtually. To my right, Julie Avenel from American Express Global Business Travel Consulting, right?
Exactly.
Samantha Sims from the Information Collective, Dr. Adrian Heisler.
Nice to meet you. And
lastly, Simon Talling-Smith from Common Pass. Thanks for joining us, Simon. Okay, so when we were planning this session, we were aware that it was going to be subject to change, and there has been a lot of change in travel restrictions since we met virtually. We had some loosening up of UK restrictions, which are coming on Monday, and the US, which of course is a big change. And then this morning I read that Australia is opening up gradually. So in this world of fast changing regulations and protocols and complexity, on the whole, we're moving in the right direction now, right? Aren't we? Julie, do you want to go for it?
Yeah, I think what we have seen in the last couple of weeks is that with the rise of the Delta variant, we have seen a bit of slowdown on the traffic we monitor in the US domestic, in APAC, in EU, but I think it has gone back and show back dynamic very quickly. European Union is partially dynamic, especially dynamic since 3-4 weeks. So back with large volume. Large volume. Happiness is a low base with more volume than a couple of weeks ago. We see as well with the US with an uptick on air. So I think there was this potentially fear or question mark around Delta variant, and we are definitely seeing from the booking we track with our clients that despite the context, with as well the opening of the different regulation and government, there is a pent-up demand coming, and we expect as well what has been announced recently by the US government to really have much more booking out of European Union, because today we were seeing the booking from the US, so definitely going in the right direction. We saw as well China back in the game, so I think we are now definitely in a mode where we're going to be in an endemic world, and we may need to manage that with different enablers and tools, and we're going to discuss around that to actually travel and move forward.
Yeah, it's all going to be around for a little while, isn't it? Adrian, do you want to give us your perspective on that?
As Julie said, things are certainly improving, and as regards the case numbers around the world, we're definitely on the downslope for the Delta surge. So we've had about 4 or 5 surges, and this one is getting better. And if you look at variants, we had a spell of them at the end of last year, and then Alpha arrived, and that was the dominant variant. And then in March, early March, was when Delta was first identified. Since then, we've had some variants of interest, but none of them has taken over from Delta. So because of Delta's transmissibility, the variants that were a little bit scarier, like Beta from South Africa or the Mu, the Lambda, they've kind of been suppressed by Delta's transmissibility. And really what we're concerned about is a variant that is evading immunity, and that hasn't happened. So it's been about 6-7 months since Delta. There hasn't been a variant of concern as identified by WHO or any of the other organizations. So I think at the moment things are looking really positive, but you've always got to bear in mind that there's a possibility of a variant emerging. And the other thing is that with coronaviruses, they can merge together. So if you have recombination, then you get the different transmissibility aspects along with the vaccine evasion together, and then you've got the doomsday scenario. But at the moment, everything's going in the right direction. I think we can look positively towards the end of the year and spring next year.
Yeah, good to hear. Samantha, you're from a data privacy background, and Simon from Common Path, so maybe we're going to have some conflicting views here on exactly how we facilitate travel going forward. But as borders do reopen and travel's becoming easier, that is intrinsically linked to vaccination programs. Yeah, that's what we've got to achieve, right?
Yeah, I mean, vaccination is undoubtedly the way forward, and we've seen that a number of countries through different methods have got higher and higher vaccination levels. So Portugal is kind of leading Europe with they're over 80%, I think, of the population vaccinated, and they've certainly seen the benefits from that. With vaccination, you'll also get people relaxing restrictions, whether it's governmental relaxation or people feeling more confident, safer. And then there have been surges in countries that have done really well. So whether it's Chile or whether it's Denmark, you get surges of cases even though vaccination is really high, because of even if you've got 80% vaccinated, you've still got 20% of a population, which could be millions or tens of millions, who are not vaccinated, and so they will get coronavirus. But vaccination is the way out in the end. There's one other thing that will help us out, and that is treatment. So in the next few months, Merck in particular are due to announce figures of a drug, an oral drug you can take as soon as you diagnose positive. And that's kind of the other aspect that's going to help us out of this, because then people who have not reacted well to the vaccination's worn off or don't want to get vaccinated, there's a tablet, or there will be a tablet, hopefully, that people can take, and hopefully that'll be licensed before the end of the year, and then it'd be like Tamiflu for flu. You just get tested, get the chemist, get your tablets, 3 days of tablets, and you don't get severe disease. So that's the other aspect. If that comes through, then I really think by the end of the year we're looking at a very positive 2022.
Okay, there was an if in there though.
They haven't released the phase 3 data yet, but it's due next month from Merck, and Pfizer as well have got another oral drug, and so it really is hopeful that will be beneficial.
Yeah, Simon, I could see you nodding there. Did you want to add something to that?
Yeah, I mean, I think that's like super encouraging news for all of us, isn't it? We're all sort of desperate to get back to some level of normality. The space that we play in the Commons Project is a lot about how do people demonstrate that they are vaccinated or that they're tested, and how do they do that in a way that they preserve their privacy. Really, really important to us. And how do we do that in a kind of systemic way around the world that actually works and doesn't clog up the airports? And I think one of the risks we've got of international travel, probably in the next 6 months, maybe even as long as 12, is that all the processes that have been put in place, and for all of you in the room that have travelled anywhere recently, even if it's only a short haul flight, you've probably seen that there's pieces of paper being clutched and waved around at check-in desks and boarding gates around the world. And what that has meant for many airports is that their staffing levels are not far short of their maximum capacity staffing, and yet their passenger volumes are only sort of 20% of normal. And we can all do the math on that. When we get back to half of normal travel, or 75% of normal travel, the airports won't work. The queues will be out of the door because we've got this document checking sort of nightmare that's going on everywhere. And no matter what progress is being made in sort of digital passes, which we'll talk about a bit later, I think, mostly people are still waving pieces of paper. And the piece of paper could have been, it's not that all UK people travel with a UK document to UK recognising places. It's people like, I had my vaccine in India and now I'm travelling from the UK to the USA, and the USA need to recognise my Indian document. And in fact, the UK airport people from my, let's say, British Airways flight out of Heathrow to New York need to be able to recognise that. How is that going to work? That's the problem, I think, we're sort of infrastructural problem that we need to solve if we're going to get travel coming, booming back in the way that we all in this industry hope that it will, business travel. And that infrastructural problem needs to get solved.
Yeah, an awful lot of fragmentation still to try and solve. And we will come back to you for a bit of an explanation of digital health passes. But if we could just tee up the first poll. So I want to ask everyone, if you can lodge your votes, how much of a barrier vaccine testing and quarantine requirements remain to international travel right now? And while you all vote on that, I'm going to ask Julie for your opinion on that.
I would say that I think at the beginning of the pandemic, we thought that we're going to have the solution to this pandemic was in the countries, in the way they're going to regulate lockdown, not lockdown. And very quickly, when we were monitoring the different stringencies by countries, which could really vary, we became aware that the solution is going to come from the individual travelers, right? So the only common solution we all have today is basically vaccination. Then the idea is like, what do you do to actually prove it, right? Mm-hmm. And I think this is what's going to come on. I don't think today I don't think vaccination as itself is avoiding basically health passport, business travel. It's just that it makes that much more complex, right? I think people who feel comfortable to fly with their passport are doing that. What we create is a lot of traveler friction, as you were saying. And the idea is like, when we're going to be back at full capacity, or we need to manage that. So it's not something stopping. What can stop people to travel is the lack of confidence, is the fear. And it feels like basically we are more and more addressing that with the vaccine. But at some point, people may travel less if it's a nightmare, if you wait and queue 1 hour just to go in London, for instance. So I think we need to find a way to smooth that. Basically, we have some time, so let's make the best use of that.
Yeah. Okay. Thank you. The poll is suggesting that just over more than half people here think it's the existing protocols are challenging. 0% said it was a minimal challenge. I'm not surprised by that. 31% fairly significant, and 15% said it's very obstructive. And it's probably going to remain that way for a little while. But Samantha, do you want to talk about your perspective on vaccination rates? Because I know you've got some views on vaccination programs.
Absolutely, and it's not just about vaccination programs in itself. It's about healthcare privacy. Individuals do have a right over, firstly, their choice of healthcare treatment, and secondly, over how they're going to talk about what type of healthcare they've received. And so when we're talking about vaccination programs, I think we need to be very careful and somewhat cautious about the route that we're heading down. When we're requiring people to demonstrate vaccination, then we should be doing so for a number of other illnesses as well. And one thing that we talk about in privacy is about the proportionality of the measure that we're using in order to address the problem. So we need to make sure that the way that we're handling information is fair and proportionate to all. And that is a really, really difficult challenge to overcome in the present situation. Because with the present situation, what we have seen is that whilst vaccinations can reduce severe illness, vaccinations are not 100% eliminating transmission or contraction of the virus. And so there is still a very real risk. And whenever we as privacy professionals have to balance this test around fairness and proportionality and ensuring that there's a necessity to collect this data, we end up in a very big struggle. And it's not to say that the issue is not a present and real threat right now. But when we think about issues, we think about, now that we're using these technologies or we're using this information, at what point will we stop? the truth is probably never. And as the way in which technology changes, you know, we're talking about AI a lot of the time, but we're not necessarily always using AI. But the thing to remember is that much of the information that we are using widely is going on to inform other information to make further decisions based upon automated processing. So after a while, your information starts to be used to make other decisions. If we talk about where the NHS is today, one thing that's been very clear over the course of 2020, the NHS entered into a data sharing agreement with a company called Palantir. What was very unusual about that data sharing agreement is that where usually in public procurement we are able to see the full commercial details around that arrangement, the commercial details of this contract were completely redacted. There was a lot of hoo-ha. Many of us in the privacy profession was asking, what's going on? So what is it you're sharing? And it was all around COVID data. I was very pleased to see that Palantir is looking for a data privacy specialist right now, so that was great to see just yesterday. However, we have to be quite mindful that in this community that we're in right now, especially the UK having left the European Union, we've been very open as a government about our willingness to depart from the high level of privacy protections to allow for a digital services economy to be more aligned with the government's vision for digital business in the UK. And there has been pressure on our UK Information Commissioner to be a less vociferous and more helpful regulator. We have to ask questions about to what extent is this technology that we're going to be relying on, to what extent has it been suitably checked, to what extent is that information that is going into this wider pool of data about COVID, about individuals, at the same time as the NHS has also set up a separate data sharing arrangement whereby we have all been asked to share our healthcare records on a much wider basis than we've ever done before. We do have to ask the questions, what is going to happen with this data and what will it inform in the future? Where am I looking at? What do I think about when I look at this as a privacy professional? Well, as a privacy lawyer, my first concern is that insurance companies will start to have even more understanding about people's approach to healthcare. And we will start to see different products and services being offered to people depending perhaps upon where they live, their age, their ethnicity, as to whether they're more likely to catch an infectious disease, they are less likely to take up mandatory treatments or recommended treatments. Will they now be shown higher rates of insurance? There is so much to come from this that could lead to huge amounts of discrimination. I think we have to be very cautious. And then there is another point around vaccination, and one thing I think we need to be quite honest about is that coming out of COVID is a new economy, a COVID economy, whereby there are a number of different tools and services that did not exist prior to COVID that have now either started or have ramped up. And in the vaccination world, we are not seeing equality across the world in the vaccinations that are accepted by each country. And so I'm Jamaican, and I live between here and Jamaica, and I know that in the very beginning wave of COVID, Jamaica was unable to get the vaccinations that it wanted and had to source those from India. And now Jamaicans are actually struggling to travel to the UK, those who've been fully vaccinated, because apparently that vaccination has not been accepted by the UK government. So moving on from just privacy issues, we need to think more around digital fairness, around rights of individuals, and what cats are we opening the bag for, right? What are we sleepwalking potentially towards? Because we are moving into what we call the fourth industrial revolution. And the way in which we use information today is just the beginning of how it will power decisions going forward in 5-10 years' time, not even.
Plenty of food for thought there.
I'll jump off my soapbox.
You've got me slightly panicked now, but I'm glad you're asking the questions on all our behalf. And I know to get in here I had to show my NHS COVID pass. Julie, I think you had the EU digital COVID certificate. Adrian, I think you made it through an entrance where you didn't have to show anything.
I am vaccinated, though.
And against your will, you decided you would download the NHS Pass and join us. So we appreciate that. But before we talk a little bit more about passes, let's go to Simon, who's got a couple of slides and can give us a bit of an overview about passes as a whole, but also specifically Common Pass. So take it away, Simon.
Yeah, thanks very much, Alec. I mean, that was really interesting on the privacy front, and something that just as a background, I come from an organisation called the Commons Project. Commons Project is a non-profit foundation. We're headquartered in Geneva, in Switzerland. Our team are pretty much all over the world, and I think Samantha will be pleased that our core objective is to preserve the privacy and give individuals control over their own health data. We started out in health data and really only got into travel when health and travel collided through the pandemic. So one of the things that we've developed quite a big footprint in is how do you verify all of these certificates? How do you make sure that you can get people traveling safely again and open up travel, but in a secure way and in a way that you know that people are not gaming the system and not traveling on fraudulent certificates? It's kind of unfortunate and really sad, isn't it, in a time of pandemic, that there is I guess Samantha referred to it as a COVID industry in forgery of test certificates. It's actually cheaper to buy a forged certificate than to buy a real certificate. How crazy is that? So verification, checking that people are either vaccinated or tested to the rules that a country has set for entry is really important. And it's messy. It's really messy. Partly because countries have had to move very fast to create some kind of digital certificate. They know that ultimately a paper-only certificate, the kind of handwritten thing that you might have got in the past, or the old world of yellow cards for malaria vaccination, some people remember those, right? That isn't going to work in this sort of world of forgery. So we need certificates that are digital. And when I say digital, of course, it could be printed on a piece of paper, like all of these you can see on the screen now. But they've got a QR code, and that QR code can be checked. It can be checked that certificate is authentic. The problem is that all of the countries have focused on their own citizens, pretty understandable for any government to do. They focus on making sure their own citizens can demonstrate their vaccination inside their country. What we haven't got very far with is, well, what do I do with my, let's say, UK NHS app when I arrive in Brazil? Do they know how to read it? Of course they don't, no. And equally, what happens when a Brazilian arrives in the UK? Do we know how to read their COVID digital certificate? And if you think about that multiplied up with 195 countries all trying to read each other's certificates, it's very difficult. Now, in some senses, it's got a bit easier in some of the big regions. So EU have introduced the EU DCC with a good deal of success, and there you've got 27 countries all using the same format, and that is already becoming one of, if not the dominant standard in these certificates. The US, of course, have gone their own way, and the US traditionally would say, no, we're not going to have a national certificate. There is no federal certificate in the US, and there never will be. We'll leave it to public-private partnership, and the market will create the standard. Commons Project, in fact, worked with some of the big health providers and technology companies on an initiative called Vaccine Credential Initiative in the US and created a standard called Smart Health Cards, which are now the main standard in the US, but not the only standard in the US. So you've got all of these different passes, all trying to be recognised. And of course, amongst that, you've even got passes that individuals can effectively abstract their health data to, like Common Pass, like IATA Travel Pass, Clear. Really importantly, where the theory there, and this is a very important part of privacy, is a kind of what the technologists would call a self-sovereign philosophy. Your data belongs to you and it stays on your phone, and you don't share your health data unless you really want to. You just share an abstracted version of it that says, hey, I am vaccinated. It doesn't tell you how, where, when. It doesn't share your health records. It just shares like a green tick. The problem is that when you try to check all of these certificates, sometimes the airline is checking, sometimes the border control is checking, and they're having to check paper certificates, paper vaccination certificates, national credentials, etc., etc. And it's very, very messy. And that's why, ultimately, still most people are wandering around clutching pieces of paper and going up to airport check-in desks and saying, I think I'm okay to fly. Not many people get to find out, are they going to be okay to enter the country they want to enter before they leave their home, which is really where you should get it done. Like, you think about your visa, you're going to US, you need an ESTA. You know that you've got an ESTA way before you get as far as the airport. You know you've got an ESTA before you leave your home. You book it and pay for it and file it weeks in advance sometimes. And so you're not worried that the US won't let you in because you know you've got a visa. The vaccination certificates and test tips, we haven't got that far yet. I mean, many people are genuinely nervous as they go through the airport. It's like, is this the right certificate? Was I supposed to get PCR? Was I supposed to get antigen? Is it 72 hours? Was that 72 hours before arrival or 72 hours before departure? All the governments have expressed their rules in slightly different ways. Not very clear, no good places to read the rules. You normally have to go to the government page and try to interpret what they've said. So it's a very confusing system. If you zoom up from it, what do you really want to get from verification? I think you want three things about verification. You want it to be trusted, private, and checked. You want to make sure that those results are not forged. They come from a place that the certificate says that they came from. They really did come from that surgery or that vaccination center or that country. And that whoever has issued it is a trusted partner, not just anybody sets up shop and starts issuing certificates. Secondly, it wants to be private. It's so important. The health data is owned by the user, it's controlled by the user. We don't want to embark on a world now where everyone starts sharing their health data inadvertently in the same way, if you like, as we've all ended up sharing our cookie data on our laptops and phones. That went way out of control, and now a bunch of large Californian organizations make lots of money out of our cookie data. We don't want people making money out of our health data. So it's important that health data is private and controlled by the user. And then finally, you want to have these certificates checked before people leave home. And then when you've checked them and you've got a green check mark, a green tick, that's what you then show to other people. And at the Commons Project, we believe that the best organization to be issuing the green tick is the country you're entering. If I'm going to Hong Kong, then Hong Kong should say, yes, you meet my requirements. They issue me a green tick, and everybody just looks at that tick. No one needs to see my vaccination certificate. No one needs to see my test certificate. They just see the green tick. The problem is it's difficult, and it's difficult to do in a standard way. We did create a service which we're working with a number of governments in the world to introduce. It's called Common Check. And it allows governments to do exactly that, to make sure that individuals have got the right documents before they leave home, issue them the green tick, not have to store any health data, not have to share any health data, and allow everyone else to see the green tick so that people can travel. So that's a quick whip around what we're doing and the background to Common Pass. I'm going to finish my sharing now. Over back to you, Alex. Hopefully that was a helpful explanation of the rather complex world of health passes and how they ought to be standardised and how we ought to standardise it in a way that we protect the privacy of the individual.
Brilliant, thank you, Simon. Whose duty is it to standardise it? Is it governments, or is it going to be driven by airlines or the World Health Organization?
Yeah, exactly. So then you enter the world of global standards, which is notoriously tricky, right? There's no one government can do it. WHO have actually recently kind of sidestepped and said they may not do this. ICAO have issued a standard, but it doesn't seem to be widely adopted. So I think you're either going to get a sort of group of regional standards, EU DCC, probably China, probably smart health cards look to be the three major regional health standards, and other people will choose one of them. It's probably where I think it will go.
Okay, Samantha, can I get your response to what Simon's talked about there, please?
Look, privacy enhancing is the new sales buzzword, okay? If you watch anything on TV right now, any set of adverts, you'll find that you've got a privacy enhancing tool to protect your VPN at home or protect your data. You'll hear that Apple sells privacy enhancing technologies. So I've been in the business of selling privacy myself for a very, very long time. Privacy doesn't happen once we put our data into something. Privacy is part of the choice as to whether I do so or not. That's the very first thing that we have to remember. And whether I wish to use an app or I wish to show a vaccination card or not is actually part of my right. That's part of my privacy rights. Does it make anything does the world become easier? Does it become easier for us to travel because I can now show this information in an app versus showing it in paper? Will my passport now become not a physical document, but actually a digital document instead because it makes it easier? I think, again, we need to be asking ourselves these questions. In fact, the World Economic Forum was one of the first organizations to come out with the passport, vaccination certificate, or whatever we wanted to call it. And the World Economic Forum did also talk about this need for standardization. We have to also remember that whilst all tech companies have not proven themselves to be the bastions of good, of digital rights that they once pretended they could be, we also have to remember that not all governments also have the very same approaches to people, healthcare information, people having rights around being able to have this information. Another thing to also consider is that the way in which technology works, what we were talking about here is a pass that when I show it to the immigration person, they allow me to get into that country. I am not really particularly bothered about what I show immigration or customs or whoever. My concern is a lot deeper than that, and it is the underlying technology. What happens, what is going on within that technology that allows all of these different systems to be able to come together and harmonize and have one standard. That means that there is somehow a lot of interconnected data transfers taking place. For that all to come together and then for me to get the green tick. The green tick, however that's presented, is not the problem. You know, the actual issue is, firstly, the underlying technology and having some transparency over how that actually works. Secondly, the number of players that need to be involved in order to make that work. And thirdly, the fact that if we move towards this as a single standard, then that means that I really have no choice than to use one of these passes to get into somewhere. Where I would like to see us moving towards is where people are actually taking more responsibility about the transmissibility or contagion of of this serious disease, and making sure that we are testing and making sure that we are taking a lot more responsibility about whether we are ill or not, rather than looking for very quick catch-all solutions just so that we can all get our businesses back up on the road.
Okay, so will you be deleting the NHS Plus?
I sure will be deleting it as soon as now that I've got in, as soon as I will be deleting it. And I'll be really honest, when the first COVID app, NHS COVID app came out, I was a huge advocate. I even did a Facebook Live for loads of people. Yes, this would have been checked. It's subject to a data protection impact assessment, yada yada. I had such confidence in the technology. I work on lots and lots of applications, so I knew the checks that I would have done had it been me working on it. So I had this huge confidence. And then things started to come out, and we started to see the pressure being placed on the ICO. The Information Commissioner's Office. We started to see the Information Commissioner's Office actually go very silent around COVID data collection. And then the app came out, and I don't know if you remember, it was actually withdrawn very quickly because it failed some of the security standards. So it hadn't been checked, it hadn't met the necessary measures that we would normally put in place. Even, my background's at CWT. It didn't even meet the standards that I would have required of the CWT's, one of the CWT's travel apps. What then happened is it came back out again, but the ICO was very open. This is an urgent time. So there are a number of things that we are allowing to happen. That was it. And so for that reason, I think we all need to be really careful. There's a lot of pressure on governmental and quasi-governmental organisations to make sure that we are addressing this urgent threat that we have right now, which means that a number of protocols have been relaxed. And we've seen it ourselves. Yeah. So as we move forward, we have to remember that there's a lot of relaxation. We have become a lot more comfortable with people asking questions that they would not normally ask. And we will start to roll back on that and feel a lot less comfortable about sharing things like vaccination status, or just your general healthcare. You and I had a conversation earlier, and I explained that I have an autoimmune condition, and it meant that for me, vaccination was a lot more challenging than it would be for most people. But have I ever sat on stage and discussed the fact that I've got a condition like that before? No. But we're in this urgent time where these things are more important. Going forward, 2025, will we be having these same conversations? No, we will roll back, we'll be respecting our privacy. And at that time, also, technology would have advanced so much further than you realise today, that something like, and I'm not talking about Common Pass in itself, but these type of applications will be powering a lot more than they're powering today. This is version 1. We've always got to think about, release 5.2, which is definitely coming.
So the message is what? Get used to it, we need it, and done in the right way?
No, the message is start to ask real questions. Each of us need to ask, what is this doing? Check those privacy policies. We all click and sign up to things all the time, but actually go back through it. What is actually happening here? What does it mean? And if we're putting pressure on organizations to be transparent, we will not head for what we've been seeing so far in terms of bias coded into so many different pieces of technology. We will not be heading towards that world of social engineering that we've seen that's been created through a lot of the social media apps. We need to put that pressure on. It's great being able to be outside again, but that may come at such a high cost that we do not know today what the cost is. So let's ask the questions. Me, I love technology. Look at me, I've got an Apple Watch, I've got everything, right? But it's not that I don't like technology, it's we've got to get under the hood of the piece of technology and understand How is it working? And is this something that's right for me? Put that pressure on, and then we can make sure that our tech market is something that's for us all.
Okay, thank you. So, and we were talking previously, Julie, you're from France, different approach to vaccine rollout, and you were sort of aghast at having to show a COVID pass for a restaurant. But if we bring it back to travel and business travel, are you finding amongst clients that there is willingness to sign up, get the vaccine, and get on the plane?
I think what we have seen of clients is like, depending on the different legislation in the different countries, you cannot have a one-size approach around mandating vaccination, encouraging vaccination, because as well, you have the question of, every individual position to vaccination, from a health part, from, whatever reason. What we have, seen our client is like definitely an encouragement to vaccination for the people traveling, as well for the safety of their employees. This is what we do as well as a company. We strongly encourage our people to get vaccinated. We have as well seen clients linking the fact to be vaccinated with returning back to the office. The reality today is like, if you want to travel, you need to be vaccinated, right? If I was not vaccinated, I would not be here today. So that's the way to get out of this pandemic. Then the question is how. So how do we find a way to report this vaccination? How do we find basically a common way so that it's standard in all countries? What we do basically to kind of cover what the Common Spring was saying is that give access to the information to our travelers, because it's changing, it's very agile. So we basically developed a free platform called Travel Vitals, where you can go and basically check, I'm in the UK today, I can know very quickly I need health vaccination. Mine is recognized because it's EU. I need as well a PCR test 48 hours before, and I'm going to need to be tested this afternoon before getting back to France. I know if I go back on the website that Monday it's going to change. So this is what we do, so that basically, travelers can have the latest information, and we restore confidence. I think as well that, the traveler community is quite resilient. We are able to adapt. The issues is like today, it's really changing fast. But I think it's definitely a must-have for a must-do for the travel industry, because technically you cannot really travel today if you're not vaccinated.
Yeah, we need to be the ones getting out there doing business.
Exactly.
Has anyone got any questions at this point for anyone on the panel? I realise I'm sort of facing that way and not that way. Okay, I've got a question over here. Is there a microphone available?
There's one here.
It's a broad question. It's a broad question for everyone, really. It's somewhat...
Just wait, sir. Thanks.
Sorry, just a broad question for the panel, whoever is prepared to answer. So, having legislative infrastructure in place in relation to data is somewhat reassuring, and people have different views on that. It's great to hear and reassuring that there are ideas and innovations and tools that we can present out, say vaccinations in this case, in a somewhat secure way. For those of us, though, who have travelled already, have had to undergo PCR tests and so on with other companies, some of which, say in the UK, have been struck off the list. A lot of very personal information and data has been supplied to those companies, however they're made up. Do you feel that the cat's out the bag for those who have already undertaken those PCR tests and so forth? Once these new innovations come in, maybe we'll be protected. But for those of us who have travelled, had to go through that process, is it too late for us? Because, supporting Samantha's point about once the data's out there, it's there. And there's no kind of taking that back, perhaps. So,
Sounds like one view, Samantha.
Yeah, I mean, again, it goes back to the point I made before. Before I get involved in anything, I need to know who you are, why you're taking my information, and how you're going to use it. And I think what has happened is, again, because of this urgent desire and urgency, has culminated in people choosing providers, or providers being allowed to be on the market who shouldn't have been. So is the cat out of the bag? Well, much in the same way when you provide information to any trader who's hasn't met the required standards, yes, to some extent. Will a startup tech company creating an application be any better than that company, than the testing provider? Probably not. Because in some cases, at least with that testing provider, they may have tested 500 people. What we're talking about with the power of an application is 5 million people, where data is going to be stored in one particular place where it could be exposed to a large number of bad actors. So, for example, I spoke very heavily about the Jamaica's data breach, was kind of a data breach, of their Jam COVID app. And really, the problem was that it's a piece of technology that was built very, very quickly by a company who offered to do it for free. And they placed it on an Amazon cloud, which was a public cloud. So when TechCrunch, an application, a media technology media, basically a blog or a newspaper type of thing, decided that they were going to screen all of the Amazon public services to see whose data was on there, Jamaica's Jam COVID app came up. And so it's much in the same way that actually people would have been better protected had they been going along to a couple of one-man bands than using that particular technology. So is the cat out of the bag? Well, it's just the way things work. Presume that if you haven't done your checks, you now don't really know where your data is. But if you do your checks, you could have a lot more confidence.
Okay, thank you. Were there any other questions just at the moment? Okay. Adrian, I wanted to ask about testing because, as Julia, you were talking about requiring a PCR test at the moment, but soon it's going to be a lateral flow test.
Yeah.
So it was what are the implications for that in the spread of COVID, potential spread? And we were talking earlier about how PCR tests can detect that for a lot longer, but maybe you should explain that medical point.
Well, I mean, in principle, there are two kinds of tests. There's a PCR test and a lateral flow test. There are others around, but those are the two general principles. The PCR test tests molecular RNA, so it picks up that very tiny genetic material, whether it's in a live virus or whether it's in a broken down virus. And the point of that being that we've all heard you can test positive on PCR for weeks afterwards, because even if your body's broken down the virus, it's no longer viable, it's still detectable. So the PCR keeps testing positive, so we don't use that anymore. It used to be you get your PCR, you go to hospital, and until you test negative on PCR, you're not discharged. That's how it was spring last year. But the folly of that came out. A lateral flow test tests on a protein of the virus, and it only tests for a short period of time when you are infectious. So in a way, that's the better test for all of us out in the public, as opposed to in hospital where you need a proper diagnosis in hospital. But what's happened with lateral flow tests is that they're always gauged against a PCR. If you've got a lot of infection, the two will go together quite happily. You'll get PCR positive, you'll get lateral flow positive. But when you're coming out of a peak, and lots of people have had it but are now non-infectious, they'll still test positive on PCR, lateral flow will test negative. But the lateral flow will be thought to be inaccurate because it's not the same as a PCR positive, when in fact the lateral flow is saying you're no longer infectious. So this is the quandary with the sensitivity of a lateral flow, 50% sensitive, but really it may be more sensitive than the PCR because the PCR is not actually relevant if you're no longer infectious. So that's why there's a problem. And I think that's why we're moving more towards lateral flow tests as being a more accurate way of assessing whether we're infectious. Now, on the other hand, if we're trying to pick up variants, you need the PCR so the governments can monitor what actual variants are around. So it's that situation where you've got to have a number of PCR tests going on for people with symptoms, say, that you can pick up variants by genomic sequencing, but also lateral flow tests as the main tool to see if someone's infectious for that period of time. So say for 24 hours, that would say, are you infectious? It may change the next day, but you've had your flight, you've had your meeting. So I do feel we're moving more to more lateral flow testing, which are more accurate anyway, and that PCR are going to be reserved more for diagnosing an infection, which is how it always was, how it always should be, and how it will be. But then other tests are coming in, so that you can now do a PCR test at an airport in 3 hours. So that's like a rapid test. You do in a hospital in 1 hour. So they're becoming now, if you say rapid test, it doesn't necessarily mean lateral flow to everyone, because you can do a PCR in an hour. And then I've not heard what's happened, but in the Netherlands and Singapore months back, they started trialing breathalyzer tests. So a breath test for COVID. And again, I haven't seen that rolled out in other countries, but certainly they're still going on. So there's certainly advances being made, but I do think lateral flow tests, for me, are the way forward, and PCRs need to be put to hospitals or diagnosing infections as opposed to screening populations.
So are governments balancing the need to keep track of infection with the need to get economies going, and it's a bit of a trade-off?
I think it's certainly the UK government. I think it's certainly why they've had PCRs going from certain countries that are deemed to be more at risk, and they want to see a PCR test to see if variants are developing, to just know what is in the country.
Yeah.
But just to get people moving, to get people attending events, then a lateral flow test is far more useful than a PCR.
And cheaper.
Cheaper, quicker, and more available.
And Simon, I could see you nodding over Adrian's shoulder from where I'm sitting, at least. Was that a signal that you wanted to add something there?
I think, maybe on that, the tests that we were talking about, there's places you can get tested, but also the previous question from the audience. I think one thing that we shouldn't overlook, and governments around the world, and the UK is certainly no exception, this needs some pressure on, is a little bit more regulation of some of these test centres. They've been set up super fast, and we've all been to test centres where you sort of think, wow, is this really a test centre, or is this someone's just back room? I can see countries where nail bars have been converted into COVID test centres because it's more profitable. It's been described, I think Willie Walsh described it as a tax on the travel industry. Really excessive pricing for testing. Many of the test centres do not seem to be regulated in the way they conduct it, and many of them do not seem to be regulated in the output. They're creating a result that is not very helpful. And so I think better regulation on the test centre, better the customer experience, the output, like what form should it come in, and maybe even price regulation. I know that I think National Audit Office took a look at it in the UK recently, or maybe one of the other consumer bodies, and actually they stepped back from recommending any pricing guidance. But it feels to me that travellers are being taxed again here. And if you're in the business of running test labs, you're making a lot of money.
I think everyone nodded there. And it also sounded like you're talking Samantha's language then as well, about regulation. I appreciate we've only got 5 minutes left, I think. Have we got any more questions at the moment? Yeah, okay, one over here.
A very short one, lateral flow, is that like when you put the swab up your nose?
Yeah, well, they're both swabs, but the lateral flow is the one where you put it in a little solution, put it on the little cartridge, and you get the result within minutes.
So like an antigen test?
Exactly, antigen test.
Okay,
Yeah,
thanks
that's right.
for
Sorry,
it. I'm
sorry.
like, I Googled it and it didn't answer the question.
No, you're right. So
We've got all the answers up here. We're beginning to see booster jabs being rolled out now. What's going on there? Do you have to have 3 jabs to be considered fully vaccinated?
Yeah,
How's that going to work?
How are you fully vaccinated? How do you measure that now? Because some people have boosters, some people don't. Some countries it's over 50, over 65, even compromised healthcare workers. And it's still very much up in the air. I think we're still in the dark as to whether they are beneficial, whether they're useful, whether people are assessing antibody levels going down, which is natural, but you can still boost them very quickly through innate cells. I think we've now got such momentum with boosters that there's no stopping them, and it's just who gets them, who wants them, and then to speak to the rest of the world, what it's taking from the world with a finite resource of vaccines, and whether this is the best use of vaccines, because we know there is still a finite resource there that is not equally spread. So there's no stopping boosters. It's a rolling stone that isn't going to stop rolling. But I do think there's a big problem with vaccine equity and spread around the world, and whether you actually need a booster. Some people may need a booster. We don't really know. But if you are immunocompromised, if you are elderly and you do know that there's waning immunity, or that your immunity wasn't very great in the first place, it may help that. But for someone who's 50 and fit and without problems, you've been vaccinated, I think that is sufficient. I don't think at the moment we have any proof that boosters will help.
Yeah, okay.
Immunity.
We are fast running out of time, and I think we agree the industry for travel, it's moving in the right direction at the moment. Don't like to finish on a negative note, but is there a possibility that it could all be completely derailed by a new variant?
Listen, I mean, all pandemics do end, and this one will end. And in some countries, you could say the pandemic has ended. They're now endemic, so it's a disease that is not causing huge problems. And there's no definition of when this ends. No one really knows. Is it when hospitalizations go down, when deaths go down? It will end. And like I said, in some countries, maybe you could say Denmark, the pandemic has become endemic. So you've got a disease that is low level, and it's just going to be there. And it's not going to go away. It will be there, probably forever. But it's gradually going to do this in different parts of the world. But there are always countries that don't have vaccination, that do have high spread, and you can get variants. Now, like I said, 7 months since the last variant of concern emerged. So all the threats that, we're going to have another variant if there's high spread. There's been high spread in loads of countries and no other variant has taken hold. It could happen. That's the doomsday scenario, that another variant emerges. But otherwise, I think enough people are saying, Dame Sarah Gilbert and the CEO of Moderna and Sir John Bell, lots of people are saying by spring next year, we're going to have loads more vaccine, spread out more evenly, and if there are no variants that come up, we are looking towards the end of this pandemic.
Okay. Oh, the perfect way to finish, I think, and a slightly more positive note than my question. So thank you all very much for joining us. Simon, thank you very much over there. Adrian, Samantha, Julie, thank you very much. A little round of applause, I think, for everyone.
Thank you.
Thank you.